fellow Ghanaians, ladies and gentlemen. You've already heard the keynote address. So let us give another ovation to Professor Asumani for his brilliant contribution. My speech will be in support. It's always good to be back at my alma mater, the nation's premier university, the University of Ghana. And I'm happy to be part of the Grand Durbar for the 60th anniversary celebration of the School of Nursing and Midwifery. The pioneer students of the school were my seniors at the university, several of whom went on to have distinguished careers in the nursing profession, both domestically and internationally. I applaud them for their achievements and contributions that have brought renown to our nation and helped improve our healthcare system. I've been following proceedings of the 60th anniversary celebration, which commenced with the launch on 24th May 2023. The Deputy Minister for Health, the Honorable Mahama Saini, Member of Parliament for Daboya Mankragu, was there on behalf of government, and I received the report on all the concerns and issues raised at the program, some of which included a new bus for students to assist them with clinicals and refurbishing the skills laboratory to make students highly adept in their practical skills. I have the assurance of the Minister of Health that within the confines of his budget, he will do his best to address sooner rather than later the concerns you have raised. Certainly, the bus will be provided to mark the 60th anniversary. As the demand for more resources to increase recruitment of teachers will also be addressed. Established in 1963 as the post-basic nursing department, focusing primarily on the preparation of nursing tutors and clinicians in education and management courses. The unit was later renamed as the Department of Nursing, following the introduction of its first undergraduate nursing program in 1980. In July 2003, the department was upgraded into a school in the College of Health Sciences by the Council of the University of Ghana, and again, renamed as the School of Nursing and Midwifery, following the introduction of a BSc midwifery program. Today, the school has 5 departments, 5 undergraduate and 6 postgraduate programs, and some 30 teaching staff, majority of whom are PhD holders. I congratulate management, faculty, staff, students, and alumni of the School of Nursing and Midwifery for the various roles they have played in bringing the school this far. Ladies and gentlemen, the theme for this school's 60th anniversary celebrations, resilience in developing nursing and midwifery workforce, embracing technology and promoting excellence, captures perfectly the history of this noble institution. Many of the successes in the progress and development of the school have been reported without highlighting all the toils and challenges. The school has shown great resilience and tenacity in the face of many setbacks in times past, in order to attain this level of development. Through it all, the school has produced a multiplicity of highly skilled and competent nurses and midwives who are making significant contributions to healthcare delivery in Ghana and beyond. As we progress in today's fast-changing world, it is essential that health professionals are equipped with the skills and knowledge that enable them to embrace technology and promote excellence in their work. We must stay resilient in our quest to develop a workforce of nurses and midwives that can overcome the challenges and difficulties they may face in the performance of their everyday duties. The healthcare delivery system relies heavily on the ability of our nurses and midwives to bounce back from setbacks, adapt to changing circumstances, and remain focused and positive in the face of adversity. Resilient nurses and midwives are in a better position to provide high-quality care to patients and to maintain their own well-being. As healthcare systems around the world continue to evolve, the importance of technology in nursing and midwifery cannot be overstated. From electronic medical records to telehealth and remote monitoring, technology is transforming the way healthcare is delivered. Nurses and midwives who are resilient and adaptable will be better equipped to embrace these changes and to use technology to improve patient outcomes. Finally, promoting excellence in nursing and midwifery is essential for providing high-quality care. We must embrace fully the initiatives of the School of Nursing and Midwifery to develop more postgraduate programs in nursing and midwifery and to expand access to these programs through different modes of delivery. This way, we will build a more skilled cadre of nurses and midwives who can apply research and advanced practices in their field of work. Before I conclude, it is important that I use this platform to bring up a subject that has been topical for many years. Our schools of nursing and midwifery have got a good reputation and have been training good nurses and midwives who easily find work in all parts of the world. But the nurse population ratio in our country still remains unsatisfactory after 66 years of nationhood. We currently do not have the right numbers of healthcare professionals with the right mix of skills and expertise in our regions, districts, and deprived communities, especially in the newly created regions and districts. The news of nurses refusing postings is thus particularly distressing. I want to use this platform to encourage all health practitioners to follow the worthy example of your great forebears who readily accepted postings in their early years at a time when the national infrastructure was even more harrowing than it is today. It was their work that helped build our nationwide health system. I'm therefore appealing to you as passionately as I can to accept postings to accredited regional and district hospitals where your services are needed most. It is appropriate at this stage that I thank all nurses and midwives for their extraordinary courage and resilience in helping the population to overcome the recent COVID-19 pandemic. That was in the best tradition of the nursing profession in Ghana. It will take time for us to build the Ghana we want. The Ghana of a good road network, good schools available all around the country, and satisfactory electricity supply everywhere. That is the challenge of our generation. Let us join hands to overcome this challenge and build the Ghana we want. Each one of us has to contribute to this endeavor, for no one else will come and do it for us. The countries we admire and want to emulate were built by their people, just like you and me, who made the sacrifices that led to the present state of their countries. If they could do it, so can we. The Akufo-Addo government has always been a strong advocate and supporter of good health and quality education. And I believe we are here today to celebrate both in one single ceremony. It is always a great time